Currently, most health services are provided by the NHS, and social care services are managed by local councils. Other services might be run by voluntary and private sector organisations, but this can get a bit complicated. We're working to improve the way health and social care services are delivered. A more joined-up approach will help to meet increasing demand and provide better care locally. Meet Mrs. Jones. She is 77 and lives by herself in a large house with no family nearby. She manages well with support from friends and her Good Neighbour scheme. One night, Mrs. Jones falls and hurts her arm and leg. She is unable to move and uses her emergency pendant to raise the alarm. Mrs. Jones is taken to hospital, where A&E confirm she has fractured her arm and leg and is dehydrated. Although Mrs. Jones is keen to return home as soon as possible, a decision is made that Mrs. Jones would be better off in a care home, and she reluctantly agrees. This is how it used to be, but things are already working differently. So what's it like now? We already have community teams providing support to prevent people like Mrs. Jones having a fall. If Mrs. Jones does fall, health and social care teams are working together, sharing information to ensure she doesn't stay in hospital any longer than she needs to, and Mrs. Jones won't need to repeat her story over and over again. As part of an integrated discharge team, we are working together to ensure the best possible discharge option for Mrs. Jones, and will carry out a full assessment after her discharge from hospital to make sure she keeps safe and well in the long term. There are also a range of support options like specialist reablement services or home care, which means Mrs. Jones wouldn't need to go into a care home. She can also make use of assistive technology that will give her greater independence and digital tools to ensure she remains active. Joined Up Care is already providing better care for people locally. So what's next? Joined Up Working is about to get even better. We have ambitious plans to deliver a number of integrated health and care hubs across central Bedfordshire. These community buildings will bring together health and care professionals, including doctors, social workers, occupational therapists, community care, and providers of other well-being services. Because these staff will be working in one place, it will be easier for them to share information and coordinate their services around the needs of local people. The idea is that people will be able to access a wide range of joined-up services in one place, somewhere local to them, at the point they need them. For Mrs. Jones, her follow-up appointments would be in one place. In some cases, she might not need to visit a hospital at all if there was a fracture clinic at her local hub. She might not even need to travel for follow-up appointments, as she can meet many practitioners virtually from her own home. Social care professionals will be able to immediately link up with health services to make it a quicker, less stressful experience. Together, they are able to work on the best solutions for Mrs. Jones and create a plan that suits every aspect of her health and well-being. It's all part of our plan to bring better care closer to home, and a more joined-up approach will help meet increasing demand and provide better care locally. Changes to the way we work are happening right now. To find out more, visit centralbedfordshire.gov.uk/better-care.